The COVID-19 pandemic has highlighted the structural racism underpinning American culture since the colonization of North America. African Americans account for 39% of COVID-related deaths, yet account for merely 15% of the U.S. population. The CDC reports that death rates are 12 times higher for COVID patients with chronic illness than for healthier people who become infected. Black Americans in general have higher rates of asthma, heart disease, diabetes, and obesity than their white counterparts, making them susceptible to more terminal prognosis if they contract COVID. While many people believe that African Americans are more susceptible to COVID mortality due to genetics or health behaviors, the true culprit is structural racism. Social determinants of health which lead to comorbidities and higher mortality rates include, but are not limited to, income, a result of generational poverty and economic immobility, and medical discrimination. African Americans are more likely to live in economically disenfranchised communities due to generational poverty. According to Solomon et al., American lawmakers have long sought to secure land for and expand the wealth-building capacity of property ownership and affordable rental housing, but these efforts have almost exclusively benefited white households. Often, they have removed people of color from their homes, denied them access to wealth-building opportunities, and relocated them to isolated communities. Across the country, historic and ongoing displacement, exclusion, and segregation continue to prevent people of color from obtaining and retaining their own homes and accessing safe, affordable housing. According to Washington Center for Equitable Growth, areas that had more entrenched redlining, federal policies that enforce segregation and homeownership, have larger racial gaps as well, leading to higher poverty rates. There is an idea that people can just pick themselves up by the bootstraps in order to have a better life, but that is easier said than done. Even after slavery, it would take more than 100 years for African Americans on average to have the same wealth as that of whites. The wage gap between African Americans and whites is extremely high. The Tulsa Race Massacre is a documented account of how Black neighborhoods have been purposefully sought out and destroyed to reduce Black economic development. West Cambridge, Massachusetts has a median family income of $166,000. This is more than double that of Area 4 Cambridge, which has a 20% Black population. The more affluent community of West Cambridge only has a 2% Black population in comparison. Mountains of research have documented large Black-white gaps in employment and incarceration, particularly among Black males. Due to over-policing, a lot of Black men end up in prison and are more prone to COVID due to living in close quarters. A lack of Black fathers signifies the separation of families and the destruction of the Black nuclear family structure. Thus, Black families on average are making less money and are less wealthy than other races. When less wealth is pouring into communities, the results are food deserts, or places that lack healthy foods. All of this means that healthy, whole-grain foods or fresh fruits and vegetables are harder to come by if you live in a Black neighborhood. In Baltimore, many Black women are at greater risk for heart disease and diabetes, and there are few parks, gyms, and supermarkets. According to grfw.org, cardiovascular diseases kill nearly 50,000 African American women annually. Of African American women ages 20 and older, 49% have heart diseases, and due to poor access to quality health care, only 52% of African American women are aware of the signs and symptoms of heart attack. Moreover, health practitioners oftentimes misdiagnose Black women's symptoms or lack any diagnosis at all. For example, a Black woman may go to a routine mammogram and be told she is just making up her symptoms, but a white woman may be correctly diagnosed with breast cancer. Similarly, a Black woman may go to a checkup and be told she has the normal flu without being tested for COVID. These are clear examples of medical discrimination. Environmental racism also has an effect on comorbidities such as asthma and cancer. An example would be Cancer Alley in Louisiana, where in 1 out of 5 homes, someone has died from cancer due to chemical companies. Well, what about genetics? Many believe that race leads to worse health outcomes and believe that racial discrimination and lack of mobility in Black communities can't be the only reason for COVID death in African Americans. Current evidence may support the notion that common ion channel variants confer an increased risk of heart rhythm disorders, and African Americans may be more susceptible to COVID. Although there's new research to show that a single gene is responsible for COVID death in African Americans, it's important to note that African Americans are ethnically and genetically diverse. Thus, there is no single COVID gene that can make the entire race more susceptible. Viewing Black people as a monolith is racist, and such research contains extreme bias. Overall, there are several factors that cause medical discrepancies in African Americans, including systemic disenfranchisement and discrimination. Environmental factors and social determinants of health account for more than 60% of health outcomes. So, how do we begin to solve the issue of racial disparities in COVID? Here are possible community-level solutions. Providers should not only talk with patients about what to eat, but also recommend sources for healthy foods in the neighborhoods. Governments need to respond to the need for nutritious options in their communities through food vouchers and subsidies. Farmers markets and food mobile vans can help fill the gap. Gaps must be filled through anti-discrimination efforts and taxing companies that profit off of the death of Black lives, including the polluters. It may take many years for African American communities to build wealth, but ultimately, restorative justice, reparations, and the end of mass incarceration and discrimination are the steps that must be taken. Thus, racism, not race, is a cause for high COVID mortality in Black communities. We must change the narrative about the responsibility race and genetics play in health outcomes, and instead think about the impact society and racism have if we want to see less racial disparities in our healthcare system.
These my dollars make it hurt.